You are listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians from across the nation, answering your questions about your pet. Bark and Wag's podcast is produced every Monday for your enjoyment, and show notes are found at www.barkandwag.com under the podcast tab.
What is canine influenza? Today we're with Dr. Susan McMillan, owner of Vet-to-Pet Mobile Veterinarian Service in Burlington, Vermont, to discuss canine influenza. Welcome, Susan.
Hi, Polly.
Living in Chicago, we have a lot of press on canine influenza, and I just wanted to let our listeners know more about it's called the dog flu, correct?
Yeah, it is. And actually, the influenza that you guys got in Chicago is a very different strain than the one that we saw in a lot of the rest of the country a few years ago. So there are actually two canine influenza viruses out there right now, at least, that we know of. The one that you guys had in Chicago was canine influenza H3N2, which isn't that important, except that it is different. And that influenza virus actually, we think, originated in the avian influenza virus in China. So the outbreak you guys had was different than the one that we've had in much of the rest of the country, dating back to maybe 2004. And that influenza virus actually started in the horse tracks, and it crossed over from horses to dogs, and it's worked its way all over the country. I think it's in at least 40 or 45 states now. So there's definitely, and this is all something we never saw 10 years ago.
And it can occur year round. It's not.
Exactly. It's not a winter thing at all like it is with people. Both of the influenza viruses, even though they are different, in a lot of ways, they're very similar. They're both respiratory viruses, and they're both really contagious. So when the dogs sneeze or cough or lick things, that's when they spread the virus. And there can be a lot of typhoid Marys.
Okay.
Or, dogs that have no signs of clinical illness, they can either be carriers, which means they're carrying it and they never show symptoms, or they're actually most contagious right before they show symptoms. So I think that's why it's been such a scary thing for dog owners, because it hit you guys in Chicago really hard.
And is it can it be passed to humans or no?
No, at this point it doesn't seem to be. There's some evidence that cats have gotten infected with one of the canine influenza viruses, but and we never know when these viruses can mutate and jump species, just like they did from horses to dogs. But no, at this point, the actual canine influenza viruses don't seem to go to the humans.
And it's a horse type of bark?
Yeah, it's a really horse. So it's in that same family. It's now called Canine Infectious Respiratory Syndrome. It's in that family of kennel cough that we all are familiar with, right? So kennel cough, the main bug behind kennel cough is called Bordetella, and that's a bacteria, and it causes that real honky, dry cough. It seems like 90% of the dogs feel fine. You've probably had dogs that have had it.
Yeah, sure.
Fine. They run around, they're crazy, happy, and they're coughing like they're going to hawk up a lung. They sound awful. They're contagious at the beginning. Sometimes we treat them with antibiotics. Sometimes we don't. And most of them tend to get through it. So that was Bordetella, but now there are a couple of other bacteria and a couple of other viruses that make this whole infectious respiratory thing just that much more serious. We used to just call it kennel cough because it was primarily seen in kennels and where dogs were in close quarters. But now, you get it at the dog park. You get it if you take your dog to work and the other dogs come to work. You take it basically any dog that's social with other dogs is open to getting one of these respiratory illnesses.
And so is there any way to treat it?
Well, it's a virus.
Okay.
So they're not as easy to treat as, some bacterial diseases we can treat really easily with antibiotics. Viruses, we usually do what is called supportive care, which means we make sure the dog is still eating and drinking and hydrated, and maybe we give cough suppressants, but basically we support the animal while their immune system deals with the virus. I guess one of the important things is that we realize that the dogs are contagious. Unfortunately, they tend to be contagious at the really beginning part of the cough. So they're often contagious before you even realize that they're sick.
Okay.
But in any case, as soon as your dog has a cough, you really need to keep him or her away from the rest of the gang. If you have play dates, play groups, whatever, you need to basically try to not have your dog participate in passing along the virus. The cough will persist for, up to 3 weeks. They'll have nasal discharge, ocular discharge. They might have a fever. With influenza, it seems that they're a little more likely to feel cruddy.
Okay.
As opposed to regular old kennel cough, Bordetella, where so many of those dogs did not miss a beat. They felt totally fine. And they didn't know why you wouldn't let them play with the other dogs because they felt fine, but they were contagious anyway. There is a vaccine. There are actually several vaccines, so it is something you want to talk to your vet about, whether your dog needs one of the vaccines, 2 of the vaccines. I went to a seminar the other night, and the representative was saying that actually right now they are recommending 3 vaccines just for this respiratory thing.
Wow.
Right. So there's one vaccine for Bordetella and para-influenza. That's kind of the original kennel cough. And now there are 2 vaccines out for the 2 different influenza viruses. So it is a little challenging because I like to think through my vaccines really carefully before I vaccinate every pet. So it's a little challenging to think about vaccinating your pet with 3 vaccines every year just for one realm of disease, which is these respiratory things. So you want to talk to your vet. It depends on where you live.
Okay.
And what kind of lifestyle your dog has. If your dog never leaves the backyard, never socializes with another dog, you don't need to think so much about this. And if your dog's real active and goes to doggy daycare and the dog park and interacts with every dog that comes on the block, then you should probably talk to your vet. And it's very regional. I'm in Vermont. We haven't seen any sign of the H3N2 that you guys saw in Chicago, at least nothing that we know of. And we had a big outbreak of H3N8, and that was either 2 or 3 years ago, and we haven't seen much of it since then. So this is another reason for an annual exam. You want to have this conversation with your vet about what your pet needs, because every vaccine protocol should really be fine-tuned to you and your pets.
Yeah, and the environment you live in. That's a good point.
Exactly.
Yeah. Well, thank you very much for the tips, Susan. It was interesting learning about canine influenza. And
Hey, it was a pleasure, Paul.
We certainly appreciate your time and look forward to our next topic.
I can't wait. Hopefully your listeners will write in and give us some ideas for things we can chat about.
Right. And as we continue to grow, you, of course, will be our expert vet that we turn to. And we'll be talking to some new vets in the future, which will be exciting. But we look forward to talking to you about different health issues that affect all of our pets, and especially about old age. I think that aging is a great topic that I'd like to have you back to talk about.
Well, I'd love to, and it's always a pleasure, Polly.
Thank you very much. Thank you to our listeners. And until next week, we will talk to you soon.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.